Good, happy Wednesday morning, January 13, 2021. I'm Riley King, and welcome to the Riley King Newscast, right here on the Riley King Network. We have a lot of news to get to this Wednesday morning, so let's begin. First up, we're going to begin with your COVID-19 updates. 9 more Granite Staters die of COVID-19. Let's take a listen to that video from WMUR News 9.
Irving Energy now offers easy online ordering for local home heating oil deliveries here in New Hampshire.
Update: 9 more people, all linked to long-term care facilities, have died from COVID-19 in New Hampshire, bringing the state's total up to 878. Today, health officials announced 842 new cases. More than 6,200 people are actively battling the virus in our state right now. 287 people are hospitalized with COVID-19.
Okay, and there you go on that video and that report. And now let's take a look at your COVID-19 in New Hampshire key data, maps, and graphs. Let's take a look at that right now. And here is a look at that information for all of you right now. There are 53,148 number of people in New Hampshire have tested positive for COVID-19. 22,775,378 number of people in the United States have tested positive. 878 number of deaths from COVID-19 in New Hampshire. 287 current number of hospitalizations for COVID-19 in New Hampshire, and 444 number of deaths from COVID-19 in the United States. Now let's take a look at this map of New Hampshire where current cases of COVID-19 are. In Manchester, 668. Let's take a look at this map of New Hampshire where total cases of COVID-19 are. Manchester, 621. And now let's take a look at these 3 charts here. Let's start with the first chart here. New cases each day in New Hampshire in the purple, daily new positive COVID-19 cases, orange, new hospitalization, and red, deaths. Let's take a look at this chart here. Current cases in the purple, total current COVID-19 cases, in orange, current hospitalization. Let's take a look at this chart here. Total cases in the purple, total positive COVID-19 cases, orange, total hospitalization, red, death, and blue, recovered. Let's take a look at this chart here. Positive PCR test rate, positive PCR and antigen test rate, and daily PCR test. Let's take a look at this chart here. Age group of cases and female and male of cases. Let's take a look at this chart here. Infections, hospitalizations, and deaths. And let's take a look at this chart here. Deaths, percent of New Hampshire population, race/ethnicity of cases, and hospitalizations. And a reminder, common symptoms: fever, lack of smell, cough, chills, difficult breathing, nausea, vomiting, and diarrhea. How it spreads, and prevention tips. And be sure to stay with the Riley King Network for the latest of your COVID-19 information. New Hampshire health officials consider how to implement new federal vaccine guidance. Federal officials urge state to expand eligibility, say they won't hold back second dose. Let's take a listen to that video from WMUR News 9, Tim Callery.
Irving Energy now offers easy online ordering for local home heating oil deliveries here in New Hampshire. Order and pay in minutes.
State restrictions on eligibility have obstructed speed and accessibility of administration.
Tonight, the federel government is urging states to expand their channels and access points for administering the COVID-19 vaccine.
We're telling states today that they should open vaccinations to all of their most vulnerable people. That is the most effective way to save lives now.
Health and Human Services Secretary Alex Azar says states should now include everyone age 65 and older and younger adults with medical conditions in their next phase of vaccinations.
Expanding eligibility to all of the vulnerable is the fastest way to protect the vulnerable. It's simply much easier to manage allocating vaccines and appointments to everyone 65 and over, rather than narrower, more complex categories.
Azar says the government will release the entire supply it has for order by states rather than holding back second doses.
Our approach continues to ensure that there will be a second dose available for someone who gets a first dose of vaccine.
In a statement to News 9, Governor Sununu says, quote, "The state is reviewing all information and new guidance coming out of Washington and is awaiting critical information from the administration regarding supply availability." And Secretary Azar says vaccines will be allocated based on the pace of administration reported by each state and by the size of that 65 and older population in each state. About 20% of New Hampshire's population falls into that bracket. Reporting live tonight, I'm Tim Callery, WMUR News 9.
Okay, and there you go on that video and that report. Nurses say they are unable to schedule second COVID-19 vaccine dose. State working to resolve issues. State officials say scheduling should resume shortly. Let's take a listen to that video from WMUR News 9, Kristen Carosa.
With all that's changed over the last year, consider COVID-19 testing from Quest, trusted by millions of people like you. Order.
Tina Svanholm is a school nurse in Hampton. She received her first dose of the COVID vaccine this month, but she says the process to sign up with the Vaccine Administration Management System was not easy. Her appointment was canceled several times.
I was finally able to get the appointment and go out and get my first shot.
Now she has to schedule her second dose, and the problems are already starting.
There was no appointments available anywhere in the whole month of February. And that has been ongoing for me for 10 days. The concern is that, I'm not going to be able to get the second appointment and the second dose as scheduled.
The concern is the same for Lisa Terrian, who's also a school nurse.
If we're going to be going into 1B and then 2A, which is a much broader spectrum of the population, I hope that they can figure out a more efficient way to get people scheduled.
Claire Gurley is a licensed nurse's aide working in Londonderry and has been trying to schedule her second dose for days. She's worried she won't get the vaccine in time for it to be effective.
All of them said I had to wait till the end of January to see if I could even get an appointment. And I'm due for February 2nd, I believe.
Tonight, the state says the issues are happening because of administrative updates, which caused a pause in the ability to schedule appointments in February. They anticipate the system will be back up and running on Wednesday. Nurses we spoke to are hoping it works.
I feel it's very frustrating that they've had so long to set this up, and there's so many glitches.
Kristen Carosa, WMUR News 9.
Okay, and there you go on that video and that report. Shaheen calls President Trump danger to country. Senator describes attack on Capitol as insurrection. Let's take a listen to that video from WMUR News 9, Amy Cavino.
Living in northern New England doesn't mean you have to spend the winter on your roof. Forever Metal roofs are designed to shed snow while the energy-efficient panels keep your home warm in the bitter winter temperatures. So instead of...
It was clear that this was an insurrection, the kind that we see in third world countries, not the kind that we expect in America.
Senator Jeanne Shaheen was in the chamber debating the first objection to electoral ballots when Capitol Police arrived and whisked the vice president out.
And then someone announced that the protesters had gotten into the Capitol, that they were armed, and that could we please
sit in our seats until they could lock and secure the chamber.
In a brief public comment today, President Trump took no responsibility for violent insurrection at the Capitol, saying his remarks to supporters were totally appropriate. Senator Shaheen disagrees.
I've been clear since I voted to impeach Donald Trump that this is a president who should not be president. He is a danger to this country.
The senator opted not to tweet during the ordeal, telling News 9 she didn't want to make snap judgments. But now she's calling for accountability.
When we have an organization like the Association of Republican Attorneys General promoting this kind of protest and the overthrow of our duly elected government, there's a problem.
On the advice of the Capitol physician, Senator Shaheen got the COVID vaccine before she left Washington. Reporting live this evening, Amy Cavino, WMUR News 9.
Okay, and there you go on that video and that report. Stock features little changed as Wall Street awaits clarity from Washington. U.S. stock index features were midly higher in early morning trading on Wednesday after a session that saw stocks alternate between gains and losses. FBI was warned of plans for violence day before Capitol riot. Let's take a listen to that video from ABC News.
And now to that chilling new report that there was an FBI internal report the day before the siege warning of a violent war at the Capitol. That some supporters were picked up saying, "We get our president or we die." And what's now being done to protect the inauguration? Here's our Chief Justice correspondent Pierre Thomas tonight.
The warning was stark. Tonight, ABC News learning the day before the riots, the FBI's Norfolk, Virginia office sent out an internal bulletin raising the specter of growing calls for violence. One online thread stating, "Be ready to fight. Congress needs to hear glass breaking, doors being kicked in, and go there ready for war. We get our president or we die." FBI officials said today the intelligence was raw, did not name specific individuals, and was shared with officials in D.C. Sources saying the mob had leadership with communications equipment and military expertise.
We're looking at significant felony cases tied to sedition and conspiracy. People are going to be shocked with some of the egregious conduct that happened within the Capitol.
The FBI also releasing new images of the person suspected of planting those 2 pipe bombs, showing a distinctive backpack and shoes. And a new detail, the bombs were equipped with timers. Law enforcement chasing down more than 100,000 leads, simultaneously racing to disrupt any plans for violence on Inauguration Day. Capitol Police telling House Democrats overnight they're preparing for more than 10,000 armed Trump supporters to descend on the Capitol for the inauguration. Some reportedly planning to form perimeters around the Capitol complex, the White House, and the Supreme Court, blocking anyone who doesn't support Trump, perhaps assassinating them.
They have published rules of engagement, meaning when you shoot and when you don't.
Today, officials arresting 45-year-old Louis Capriotti of Chicago, who allegedly threatened to kill members of Congress, in a voicemail saying, "We will surround the blank White House." Concerned lawmakers suggesting all members of Congress go through metal detectors at the inauguration. Law enforcement in all 50 state capitals preparing for demonstrations.
If there's any type of disorder, we will have the reinforcements there.
As the FBI tracks down hundreds of rioters. Aaron Mostofsky, seen at the riot holding a Capitol Police officer's shield, is the son of a New York City judge. He was arrested this morning. Jake Angeli is now in an Arizona jail, facing multiple charges. His mother says he initially refused to eat after turning himself in this weekend.
He gets very sick if he doesn't eat organic food. Literally, will get physically sick.
All right, so let's bring in Pierre Thomas with us tonight. And Pierre, of course, all of this is very unsettling for people watching at home. The security surrounding the Capitol, the inauguration just days away. Is there any talk of moving the inauguration to another location, or are authorities still convinced that they can protect the president-elect, the vice president-elect, and all of those who will gather with them?
David, law enforcement officials continue to say the venue has not changed, but the security situation is becoming so serious, those discussions may come up, David.
And Pierre, the original plan, I know, was to set up the security perimeter the day before the inauguration around the Capitol. They've now moved that up significantly?
Yes, they have. They're building additional layers of security, bubbles within bubbles, in order to harden the inauguration perimeter. They want to make it impossible for someone to get to members of Congress or the new president. David, it's so intense. Congressional leaders have been told they will be reimbursed if they buy bulletproof vests.
That's just extraordinary. I know they're going to begin that security, those bubbles you speak of, this week now. Pierre, thank you.
Hi.
Okay, and there you go on that video and that report. And that does it for this morning edition of the Riley King Newscast right here on the Riley King Network. Thank you for watching. Have a great rest of your day, and I'll see you back here later on today for another newscast. I'll have a news report coming up in a little bit. Goodbye, everyone.